Hello everybody and welcome to our group's presentation regarding Tapentadol. Tapentadol is an analgesic drug which is in a class called opioid narcotic analgesia. It is often used in a hospital setting due to its ability to provide quick and effective pain relief which can easily be prolonged to continue for a chronic pain. I will briefly touch on its mechanism of action before diving into its indications to provide a better background information regarding the drug. Tapentadol is a synthetic, centrally acting analgesic that functions as both a mu receptor opioid agonist and a noradrenaline reuptake inhibitor. It alters both the sensory and emotional component of the brain by activating mu opioid receptors. This can block pain transmission in the spinal cord and influencing how pain is perceived. By preventing noradrenaline from being reabsorbed into nerve cells in the central nervous system, this in turn enhances it in the brain. This in turn has another effect which enhances the analgesic reaction. Now we know how it works, we can dive into the indications when this drug should be used by an advanced care paramedic pre-hospitally. It is indicated for moderate to severe pain which cannot be controlled by non-opioid medication. This is as opioids are very highly addictive and which have been seen to be addictive by many people. It can also be used for acute pain once other analgesic options have been exhausted. It can also be indicated for people who are experiencing chronic pain, as well as neuropathic pain, which can be seen in diabetes neuropathy. In Australia, it is most often seen in a tablet form, which comes in both an immediate release and an extended release over various dosages. IV form is not often used in Australia and would be impractical to paramedics due to the range of opioid medications they already carry. I will now hand over to Olivia to discuss the contraindications for this drug and why it shouldn't be used.
Thanks, Oliver. I will be discussing the contraindications of this drug. There are many contraindications for Tapentadol, but today I will go into depth for the leading ones, linking them back to the mechanism of action. Firstly, I will be speaking about the risk of respiratory depression, which is caused by the mu opioid receptors, which are stimulated in the brainstem, which inhibits the brain's response to rising carbon dioxide levels, which results in the reduction of respiratory rate and depth, leading to hyperventilation. Following respiratory depression, severe or acute bronchial asthma in an unmonitored setting. This can be caused by, similarly to respiratory depression, the mu opioid receptors target the brainstem, which causes a depression in respiratory dive. In this case of bronchial asthma, the airways are already narrowed and obstructed, making it even harder for the patient to breathe. Patients with a history of epilepsy and seizures. Tapentadol increases the risk for seizures because tapentadol inhibits the norepinephrine intake in the CNS. The elevated levels of norepinephrine can increase the neuronal excitability in the areas which seizures generate, including the cortex. Tapentadol lowers the seizure threshold, which increases people who are prone or have a history of having seizures are at more risk. The last contraindication that I will be discussing is the most obvious, allergy or adverse drug reaction. If a patient has had a history of allergy to opioids, this could result in an allergic reaction or death.
Tapentadol can trigger some common array side effects which vary from a person, such as effects on the respiratory system, including slowed or difficult breathing, as it binds to mu receptors in the central nervous system, which can cause CNS depression, therefore leading to slowdown in breathing, shortness of breath, feeling of fainted, dizziness, confusion, and trouble staying awake. Tapentadol can also have affects the cardiac system, including can cause hypertension, especially in a patient with an ability to maintain adequate blood pressure and those with the reduced blood volume. This is due to its mechanism that causes a peripheral vasodilation, which leads to drop in the blood pressure, there causing hypertension. Tapentadol can also cause symptoms of dizziness, blurry vision, feeling faint or lightheadedness. This is due to the drop of blood pressure making a person experience dizziness and lightheadedness, and commonly seen when a patient, in people with low blood pressure, when suddenly stand up after being seated for a while, they're more likely to feel fainted. Tapentadol can also cause some neurological effects, including serotonin syndrome. This is due to the drug primarily affects on the central nervous systems and the peripheral nervous system due to excessive serotonin activities. Tapentadol can also cause some suicidal thoughts. This is because it causes rare mood changes, and depending on the individual, some people can experience changes in behaviors, such as engaging in risk-taking behaviors and in thinking about engaging in self-harm. Tapentadol can also cause some severe headache, as all opioid induces headaches, which can lead to changes in how the body processes pain signals, potentially causing an increase in pain sensitivity and rebound headaches. Tapentadol can also cause seizures, especially when it's taken in combination with other medication, whether it be opioid. It's all due to the mechanism of action involving opioid and the norepinephrine system, and also precaution must be implied in patients, especially with those with history of seizures. And tapentadol can further cause or produce symptoms of agitation or hallucination. This is because all opioid causes agitation can occur both as a direct side effects or of the use of the opioid or as a symptoms of withdrawal. Tapentadol can also have an effect on the renal system. This includes like lower cortisol levels. This is all because it can acutely suppress cortisol circulating in the bloodstream, therefore causing cortisol level circulating in the bloodstream to be reduced on a baseline. And then furthermore, tapentadol can also cause some kidney impairment, such as urination difficulties. In some people can actually experience changes in the pattern of urination or difficult urinating. This also is manifested as a decrease in urine production, urine retention, or difficult urinating. And tapentadol can also have an effect on lower GI, causing constipation. This is because all opioid medication slows down the movement of stool through the intestine, allowing the more water to be reabsorbed and making the stool hard and difficult to pass. It's just due to the activation of opioid receptors in the gut, which affects motility and fluid absorption. It can also further cause heartburn, GERD. This is all due to the slowdown of stomach emptying and potentially impairing esophageal motility, leading to stomach acid reflexes into the esophagus, causing heartburn. Lastly, tapentadol can cause a loss of appetite and nausea through various mechanisms that affects the brain reward pathways. You can reduce and pleasure delivering from it.
The next topic being covered is precautions. Opioids such as tapentadol are a high-risk drug that have a range of factors that can influence the body, especially when used for long periods of time. Respiratory depression is a major precaution to consider when administering tapentadol. Patients are at high risk of respiratory depression at any time after administration, however, more so after the first dose. The effects are produced by the drug activating opioid receptors expressed on neurons within the respiratory network of the brainstem. This risk is higher in large doses of the drug, mostly in modified release and high potency formations. Tapentadol can also cause sleep-related breathing problems due to it being a mu-opioid receptor agonist. It can cause problems such as central sleep apnea and sleep-related hypoxia, as the brain can stop sending signals to the muscles that control breathing instead of only reducing pain signals. Another precaution may include increased likelihood of seizures. The use of opioids like tapentadol lower the seizure threshold through neuroexcitation or by interacting with brain receptors that regulate neuronal activity. This also puts patients who are taking other medicinal products that also lower the seizure threshold at higher risk. Much like other mu-opioid receptor drugs, tapentadol should not be considered in patients who may be susceptible to the intracranial effects of carbon dioxide retention, such as patients with suspected increased intracranial pressure, impaired consciousness, or coma. This is because the activity of the mu-opioid receptor agonist may obscure the clinical course of patients with a head injury, potentially worsening the condition by masking or altering neurological signs. This may make it difficult to accurately assess a patient's condition. Hyperalgesia is also a precaution to consider when administering any opioid. Some individuals have an abnormally increased sensitivity to pain, meaning that stimuli can be perceived as more intense and painful where normally they aren't. If this is suspected, it may be necessary to consider a reduced dose to see if it relieves the pain.